living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Colorectal cancer is the second leading cause of cancer death in the United States, and it's preventable. Flu is preventable too. So when you go in for your flu shot, you may be offered one of the least invasive, least expensive forms of colorectal cancer screening, and you can do it right from home. My guest and I will be talking about the importance of getting a yearly flu shot and about this life-saving form of colorectal cancer screening. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Lisa Sather, your host. Stay tuned. Welcome back. My first guests are Amber Rogers from Mountain Pacific and Emily Coyle from the American Cancer Society. Mountain Pacific and the American Cancer Society are teaming up for the second year to make sure Montanans aged 50 and older are protected from the flu and colon cancer through a program called FluFIT. Welcome, ladies.
Thanks.
Thank you for being here.
Thank you.
So let me start with you, Amber. Can you talk to us a little bit about what FluFIT is?
Sure. FluFIT can be conducted in a physician's office, in standby clinics, pharmacies even, and it really pairs the annual flu shot with the opportunity to screen people for colorectal cancer screening. So it's really helpful to pair two preventative services into one visit.
Very interesting. So the flu shot and colorectal cancer seem a little bit disconnected. So talk to me a little bit about what the purpose of that is.
Well, the purpose is that usually people come to the physician's office at least once a year, and colon cancer screening occurs very infrequently in those patients that are 50 years and older and need to be screened. Many times there's a reluctance to get screened for colon cancer because of the prep and having a colonoscopy. There's a fear there. So this preventative service pairs the flu shot with a discussion about how important colorectal cancer screening can be. It's basically pairing two prevention efforts into one.
Now, I think there was a little bit of information on some randomized controlled trials that kind of talked about how that has improved screening.
Yes, they actually have studied this extensively, and the doctor that created this actually had nurses that were conducting flu clinics. You know, when you go into a big queue and you're in line to get your flu shots, usually these can be conducted by your employer. They can be conducted at various health clinics, health departments, and they found when the nurses educated the patient screened the patients for the need for colon cancers screening, as well as educated them about the process and provided them with the test kit, that the prevention efforts of both services actually improved.
Very interesting. That's good news. So Emily, let's switch over to you. So can you talk to us a little bit about some statistics? You know, really I'd like to hear how many people in Montana and Wyoming each year potentially get colon cancer, and how do we compare with the rest of the country?
Sure. Well, we have some challenging situations in Montana and Wyoming in regards to the geography and certain factors that contribute to increased rate of colorectal cancer, as well as reduced numbers of people screened. So here in Montana, according to the Department of Public Health and Human Services, we have about 490 people on average each year who are diagnosed with colon cancer. That might not seem like a lot, but we do have a pretty small population as well for such a large state. So, colorectal cancer, it's the third most diagnosed cancer in Montana, and it's also the third most common cancer-related death in the state. So among both men and women, we know that nationally it's the second leading cause of cancer death, and also the third most diagnosed nationally. In Wyoming, the average number, again, it's a smaller population, the average number of people diagnosed is about 221 per year. And it's the fourth most common diagnosed cancer in the state. For both men and women, and second leading cause of, the second in mortality for men and women as well. So what we know about colon cancer is that when you catch it early, you can treat it more easily and many times cure it. So we know that the 5-year survival rate, which is if you're diagnosed with cancer, the likelihood of being alive 5 years later, if it's caught in stage 1, the very earliest time that it can be caught is 92%. So your chance of surviving colon cancer is really good if you get it detected early. The challenge is so many people aren't getting screened. Here in Montana, we're seeing about less than 2/3 of our population are actually getting the recommended screening when they need to get it. We are about 46 or 47 in the country out of all 50 states here in Montana for the rate of screening. So that we're really at the bottom of the list. Wyoming is at the very bottom of the list in terms of their screening rates. So there's a lot of opportunity here to increase those numbers. We know that certain populations are less likely to be screened for colorectal cancer. That includes American Indian populations, rural populations. They have a lot of challenges with access to screening, transportation, overall, their preventative health activities tends to be a little bit lower. Men are less likely to be screened for colorectal cancer. People with lower education levels and income are also less likely to be screened. So here we have a heightened need for FluFIT in Montana and in Wyoming, where we have a higher percentage of the population that falls into those categories.
Thank you. That's staggering. Great information. So the thought of getting a colonoscopy for some people is a turn off, and if the FIT test is available, we know this. Are there some other non-invasive tests that are available for folks to use?
Sure. So there's another one called the guaiac-based blood test, which is you need to get the high sensitivity guaiac-based test. That's also an annual test similar to the FIT. There are fewer dietary restrictions with the FIT, but the guaiac-based test is also an option. Again, I want to stress high sensitivity because there are different types of those tests, and you want to make sure that yours is going to be the most effective and accurate. There's also a newer test. It's the stool DNA test, and that one can be done every 3 years. It's relatively new, however, and it may not be covered by insurance. So really, this is why the FluFIT is such a great option for folks.
Great.
And just to put in for that, the average cost to the patient is it's usually free because it's one of the preventative services. But even if you had absolutely no insurance, the FIT test runs around $15. So
very inexpensive.
It's very economical for those people that are concerned about costs of care.
Yes, great.
And just so you're aware, if there is a positive FIT stool DNA or FOBT, which means, if there is blood that's present in the stool, then your doctor will order, most likely, another test, such as a colonoscopy or a sigmoidoscopy, just to see if there's cancer or to rule it out. But if blood isn't present, then you probably don't need another test for another year. So just like your flu shot, you can get that knocked out. And the other thing is, as long as you don't have a personal history of polyps or colon cancer, or a family member who got colon cancer before the age of 50, you don't have any symptoms, these tests are really likely good options for you. The best thing I can suggest is just talk to your doctor about what's most appropriate for you.
Great information. Can you share with us really quickly, you mentioned that colon cancer is quite preventable. How can that be? Talk to me a little bit about that.
Absolutely. So one of the interesting things about colon cancer is it typically is a very slow growing cancer. So colon cancer typically starts off as a polyp, which is a growth inside your colon. And it takes 10 to 15 years in most cases for a polyp to develop into colon cancer, which is why the recommendation for colonoscopies is every 10 years. So if you have a clean one, which means you have no polyps detected, you have another 10 years before you need to get it. However, if polyps are detected, they can remove the polyp before it develops into cancer. So you're preventing the growth of cancer simply through the act of a screening colonoscopy and removing that polyp. It can also, obviously find cancer at its earliest stages through that process when it is the most treatable.
Thank you. Great. We have about 45 seconds left. Real quickly, can you tell me what folks are at greater risk? And I think you mentioned a little bit earlier, but there might be some other things you want to hit on.
Yeah, so you might have heard the phrase, genetics loads the gun, but lifestyle pulls the trigger.
Yes.
So that's something to really keep in mind. There are a lot of factors. People who, have a family history of colon cancer. They may have had polyps before. They may have irritable bowel syndrome. But the other factors, that you need to take into consideration, those people who are obese, maybe they're less physically active if they eat a lot of red meat or they eat a lot of processed meat. Just really the key is here, really pay attention to your lifestyle. There are factors that you can take to prevent your risk of developing colon cancer. So
Great.
eat more vegetables, eat more fiber, get your screening.
Thank you. We'll be back after the break here, and we'll talk a little bit more with the ladies. Stay tuned. Welcome back, ladies. We'll
Thank you.
continue our conversation. So again, Emily, back to you. I thought it was interesting. I've heard that people younger and younger are getting diagnosed with colon cancer. Can you talk to us a little bit about that?
Sure. So the American Cancer Society released a study recently that showed that people born in the 90s were about 2 times more likely to develop colorectal cancer than people born in the middle of the last century. We don't really know why that is. There are some there's some suggestion that we've made some changes in our lifestyle and diet, physical activity levels that are contributing to that increase, but so far the evidence is inconclusive. They're continuing to look into that to find out what are some additional factors. That doesn't mean that we're changing our guidelines or our recommendations. So we still recommend starting at 50 unless you have a family history or other symptoms to get your screening starting at, because really your overall risk of developing colorectal cancer is still very low. So, the American Cancer Society and other organizations, including the United States Preventative Services Task Force, which issues those guidelines and recommendations nationwide, is still sticking with that. Let's get our screening starting at 50 and monitoring these trends very closely to see if we do need to change those guidelines in the future.
Great, good information. Thank you. So Amber, let's switch over to you and talk a little bit about the flu.
Sure.
So let's talk about the flu. What is the flu? And are there certain populations that should get a yearly flu shot?
Everybody over the age of 6 months should get an annual flu shot. That is incredibly important. So you asked about the differences between the cold and a flu. The flu can be quite a severe illness. It is way more severe than a cold. Even though a cold may have some upper respiratory symptoms, the flu is extremely contagious. It often is coupled with bone-chilling aches and pains. It can be spread extremely easily, especially to elderly family members that you may be in contact with. And in addition, there's usually high fevers and chills. So it is something that, millions of people get the flu every single year. And not every flu is preventable, but for those that are most at risk, which are the elderly and the young and those with chronic illnesses, it's really important to prevent as much flu as we possibly can. And the flu shot is your best shot at doing that.
Thank you. Well, so the symptoms are kind of similar between the cold and the flu. Is there a test to differentiate between the two?
There actually is. There is a nasal test that they can perform that can verify not only that you do have the flu, but also what type of flu it is.
Great, thank you. So if I do get a flu shot, is there a chance I can still get the flu?
Yes, there is. And there's lots of reasons behind that. First and foremost, once you receive a flu shot, it takes 2 weeks for the immunity in your system to build up. So if you were exposed to the flu prior to getting the flu shot, or within the 2 weeks before your immunity has built up, you simply got your flu shot too late. And so when people say that they got sick with the flu, even though they received a flu shot, you have to kind of look at those factors. The other issue that can happen is that There are several CDC experts that plan ahead of time and look at the most prevalent flu strains that are across the country. And so they develop a flu package. They started that as soon as the last flu season ended. And so you could have contracted a different strain of flu than what was actually in the vaccine. However, I do want to stress the point that if young and healthy people fail to get their flu shot and they do obtain the flu, they are so much more at risk of spreading that flu virus to those vulnerable populations that they're in contact with. You know, elderly, people that reside in nursing homes, your parents, your young children, all of those people really can't afford to get sick.
Thank you. So if I do get the flu, is there a way to treat that?
The best treatment is to stay home, rest in fluids, and perhaps some Tylenol.
Okay.
However, there is a class of drugs called an antiviral drug, and that can be prescribed by your provider. It only really works the best if you take it within the first 2 days of your flu illness. So many people haven't quite come to terms that they have the flu yet. So many times by the time a patient recognizes that they have the flu, it might be a little too late to be successful. The antivirals, in addition, they really only cut out 1 to 2 days of being ill. So it's not like you can take a miracle pill and feel better right away.
Yes.
So
Thank you.
they are available, but they are prescription only, and you need to go to your doctor and have a confirmed flu test before you receive an antiviral.
Great information. Emily, back to you. So the FluFIT program yet again, is there anyone that really should not participate in the FluFIT program?
Yeah, absolutely. So I will say that everyone should get the flu shot, as Amber said, but in terms of the FluFIT, if you have a history of colorectal cancer, you've had polyps before, you've had a family member who's been diagnosed before the age of 50, you're likely not a good candidate for the FluFIT program. People who have had a negative FIT test in the past year, or which means they didn't detect any blood in the stool, or they've had a normal colonoscopy within the past 10 years, wouldn't need to participate in the FluFIT. Okay. So either a FIT or FOBT that's negative in the past year, or a normal colonoscopy in the past 10 years. And that's pretty much the guidelines. But I do want to say that's for the FluFIT specifically. Do get your flu shot every year.
Thank you. So, healthcare professionals and doctors are busy trying to take care of business every single day, and it seems like maybe learning a new program for them might be time-consuming and a pretty big commitment. So what types of activities are underway to help make sure that doctors and other healthcare professionals that want to do this program are receiving the support that they need in order to deliver the FluFIT program?
You make a really great point. We are seeing more and more the amount of time that we have with our family physicians or our nurse practitioners is just getting shortened, and there's so much to cover in such a short period of time, and doctors and health professionals are asked to keep up with a lot of changing information. It seems like guidelines and recommendations are always changing, and they're not just dealing with cancer. They have so many other issues that they need to address in an office visit. What the American Cancer Society, Mountain Pacific, the state, Montana and Wyoming State Departments of Health, Primary Care Association here in Montana, and our insurance partners, Blue Cross, Pacific Source, are all doing is really working to support education for providers. So we've held a series of webinars that are across our Fort State region with Mountain Pacific to educate office staff and physicians and providers on the best way to conduct a FluFIT clinic in their setting. We're traveling this fall with some of our ACS experts to different clinics throughout Montana to educate providers in those settings on the FluFIT program and evidence-based colorectal cancer screening in general, so they have all of the information that they need to make the appropriate recommendations. So we're really doing everything we can to make sure that we're making those resources available and as easy to obtain as possible.
Great, thank you very much. So, in about 30 seconds or so, can each of you just drive home your take-home messages that you have brought to us today? That would be great. What take-home messages would you have to say?
I guess I would say get your flu shot, if not for yourself, but for your family.
Very good. Emily?
I would say, you can save your life if you get your screening from colon cancer. And you can also improve your chances of not developing colon cancer by eating well, exercising, and seeing your doctor on a regular basis.
That's such great information. I want to thank you ladies so very much for being with us today. It's valuable information. I learned a lot. There's a lot of things that I wasn't aware you were all doing, so I appreciate that. It's a topic that's near and dear to my heart, so thank you very, very much.
You're welcome.
Yes, thank you. So the bottom line, if you're 50 or older, get a flu shot and get screened for colorectal cancer. If your doctor isn't participating in the FluFIT program, ask about your options. Home tests are reliable and can detect potential problems. Also remember that you have a choice of which colorectal cancer screening test you receive. Yearly FIT tests are easy to do at home. Talk to your provider about flu and CRC screening. You're the driver of your care. Be an informed healthcare consumer. Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.